Hello, hello. My name is Journey Brown. This is my audio or my part two of assignment two. So if I keep looking over there, it's because I have two screens. I have the one with the camera, and then I have my main screen that I use that I'm reading off of. So if I'm not looking straight into the camera, I'm really sorry. But to get started, I used to work as a scribe, so this assignment really wasn't a super hard one for me. But well, so let's say I'm doing one of my handoff scripts. Hi there. I'm Dr. Journey Brown, and I'm transferring care of a patient in bed 4 to you before my shift ends. So you would be the other doctor. This is a 58-year-old male, patient ID number, blah, blah, blah. He has a known allergy to penicillin. He initially presented to the ER in acute distress. He complained of severe crushing chest pain that radiated down his left arm and up into his jaw. According to his history, he struggled with unmanaged hypertension for the last 10 years. When I examined him, he was extremely diaphoretic and anxious. His vitals were significantly tachycardic, with a heart rate of 115 beats per minute. His blood pressure was elevated at 60/95, but his lungs were clear. Given his presentation, we moved on to the next one. I immediately ordered a stat 12 lead electrocardiogram, which showed an ST elevations. My clinical impression was an acute myocardial infarction. So I immediately called for a cardiologist consult. We sent him straight to the emergency room for emergency coronary angiography to visualize, to look at his blood vessels. And the imaging confirmed he had severe atherosclerosis that resulted in a 90% occlusion to the left anterior descending artery. And then that blockage was causing really bad ischemia to the wall of his heart, meaning that his tissue was being starved of oxygen, so he was feeling lots of pain. To restore that blood flow, I immediately did a coronary angioplasty. With that, we were able to successfully maneuver a balloon catheter to the blockage, inflate it, and deploy a stent to keep the artery open. The procedure went well. He achieved complete hemostasis, and the final insertion site using a closing device, and at the femoral insertion site using a closing device and manual pressure, so there wasn't any more bleeding. For my final recommendations, I recommend that the patient be transferred to the cardiac ICU for more monitoring. It's extremely important that his femoral access is checked every 15 minutes for the next hour to ensure that hemostasis is holding. I also recommend to start him on dual antiplatelet therapy, beta blockers, and high-intensity statins right now. Statins and stuff to also handle plaque buildup. Excuse me. For right now, he's stable, but we need to watch his cardiac rhythms closely overnight. So, and that's pretty much it. The rest is in, I would say, your hands. So, thank you so much. Hopefully that is my only take. So,